A beautiful evening to us all. Hello, beautiful people joining us from across the globe. It's always wonderful coming your way on Sundays with your favorite health show, Health Plug Conversations. I hope you're doing well and you've had a good week. And I hope that you had a very health conscious week as well. Thank you so much for joining us here at the Health Plug Conversations YouTube channel today. My name is Dr. Vanessa Bokomokwe. I am your host for today's health segment, and I want to welcome everyone, especially those joining us for the very first time here on our health talk show. This is the Health Plug Conversation. It is a health channel that gives you the avenue to have access to right health knowledge, gives you practical tips, and helps you have honest conversations with experts in the healthcare industry. And all this that we are doing is to make sure that you are on top of your health game. And today, I promise you, is going to be exciting, is going to be insightful, and is going to leave you more healthier than you came. Therefore, welcome once again to our session. I want to give you an opportunity to save a life. I want to give you an opportunity to be a blessing today. So let's do this. Pick up your phone, pick up your tablet, pick up your PC, call someone, text someone, remind someone that it's time for Health Plug, and so share the link and invite them to come on board. We don't want to leave anyone behind. Today, we leave no stone unturned. So let's do this before we start our amazing session today with our guest. I promise you, our guest is excited and waiting to be here with us. And by way of introduction, another best part of today's show is the welcome that we have for everyone. So, all those of us who are joining, you want to welcome your fellow person. Let us know where you are joining from, your name, and where you are joining from, and your expectations for today's session. It's another health plug conversation, so it means that it's going to get hotter and it's going to get more insightful. Let me hear from you. Where are you? Who are you? And where are you joining us from today at Health Plug Conversations? I'm excited because today we talk about something that people don't like talking about: teeth and everything else, guys. Yes, amazing. So, I was at home a couple of days ago when a friend called me that they wish they had more time with doctors. They wish they had more time with healthcare experts. It looks like we are always around jumping, trying to seek attention, but the queue is long. And he had questions. And that's when my team and I from Health Plug Network decided to bring you one of the best of the best. Okay? She's one of the best out there in Ghana and definitely even in the whole world to help us answer our pressing questions on our health, especially when it comes to oral health. Our speaker for today is a dental surgeon by profession. She is a friend of mine, a sister. We went to school together. She's a proud alumnus of St. Rose's Secondary School. So those of us who are from Rosa, shout out to you. You have your alumni repping here live and colored. She's also currently working at PB Clinic at Sakumono. When she's not helping people have a better smile, she loves financial literacy. She literally told me that she wants to be a billionaire kingdom financier, guys. That means that we are not only living here with health, but we are definitely living here with wealth. I hope I get some of the dollars before you leave, guest speaker. Amazing. So, beside helping people now, she is a kingdom financier and she loves good food, good music, and tuning or turning her spiritual side. Her aspirations really is to be an orthodontist or a pedodontist in the future. And all she wants to do is to help change lives a smile at a time. Ladies and gentlemen, fellow amazing people joining me today, help me welcome to the stage our one and very own guest speaker, Dr. Jokobed Ama Eduache. Welcome so much, Jacobert. It's good to have you.
Thank you, Dr. Nessa, for that wonderful introduction. Eish, I feel I'm flattered. Thank you so much for having me.
You're warmly welcome. I'm glad to hear you and I'm glad to have you, especially you taking time off your busy schedule to be here. But then again, I'm sure
Okay.
my guests want to know the Bologna Kingdom Financier. Are you selling some dollars today for us?
Yeah, sharing dollars in the form of wealth, of knowledge, of knowledge.
I see, guys. She said we are sharing dollars in the form of knowledge. So let's see.
Yes,
I see the
health is
excitement in my
wealth.
comment section. So we have Samuel joining from Kumasi. Hi, Samuel. It's good to have you. I see Dr. Belinda also here. Welcome, Dr. Belinda. It's good to have you. I see one of my many amazing networks I'm joining. If you're on YouTube, you want to definitely join them. Holistic Medic Network. I see you. Welcome to today's session. We'll be diving right into our session today on oral health. So, Dr. Jokobed, anytime people hear dentist, there's something that they always say: teeth doctor, teeth doctor, teeth doctor. Today,
Yes.
we want to understand what really is the oral cavity. Is it just all about teeth? Is there something more to it than it meets the eye? What is the oral cavity?
Okay. So thank you, Dr. Nessa, once again for this privilege. So, straight to your question. When we talk about the oral cavity, the first thing that comes to the mind of many people is the teeth. But beside the teeth, there are many other structures in the mouth or the oral cavity. So, some of these structures are the tongue, you have your lips, you have the palate, which helps you in swallowing and also pronunciation of certain sounds. We also have the salivary glands, which are what produce saliva to prevent our mouth from getting dry and also to aid in digestion of our food. We also have muscles that help us in chewing. So we have muscles, we have the tongue, we have the salivary glands, we have the palate, and then the teeth, the great teeth that most people know about. So yes, that's it about the oral cavity. It's beyond just the teeth that we see or know we hear about. Dr. Nessa, I think you are muted.
Thank you very much. Thank you so much for shedding light on what the oral cavity
Yeah,
really is. We get to learn that
yeah.
it's not just about teeth, guys. We have the lips, we have the mouth, we have the hard palate, we have the tongue, and then the soft palate. And we got to learn all this today from Dr. Dent Jokobet. Right, so now that we know what oral cavity really is, what then is oral health? I think Tuesday, 2 days ago, we celebrated World Oral Health Day, and I'm not sure a lot of people know what this oral health is. What really is this oral health we are talking about?
Okay. So the WHO defines health as the state of complete well-being of an individual, physically, the complete well-being of physical, social, and mental well-being of an individual without the absence of merely disease. So when we bring this to the oral health, it refers to the state of the mouth or the oral cavity and other orofacial structures, which I mentioned earlier. So the state of this oral cavity and other orofacial structures, which enable an individual to perform vital functions such as speaking, chewing, and also going about your day without discomfort, pain, or embarrassment of any form. Yeah, so that's what the oral health or oral health is about.
Right. So it's not just about maybe your teeth looking nice, guys, but I'm learning today that there's speaking involved, there is eating
Yes.
involved, and then there is chewing as well involved. Now, taking all these things that we say about oral health, how does that translate into oral hygiene when we talk about good oral hygiene? What is that all about?
Okay. So Hygiene from our basic or elementary education involves, when you talk about hygiene, everybody talks about, remembers how to keep themselves neat. So it's literally the same when you talk about oral hygiene. So when you mention oral hygiene, what will come into most people's heads first of all is brushing, which is the most common and convenient way of keeping our mouths clean. So it entails brushing, flossing, which I know a lot of people here will be learning today, and also regular dental visits. So that is what oral hygiene in summary entails: brushing, flossing, and regular dental visits. That's what it
Interesting.
entails.
I'm really learning today. I have a feeling that today is the judgment day because I'm sure that you'll be exposing a lot of the sins of my viewers and I when it comes to
Okay.
our oral health. Please have
We're all here
mercy.
to we are
The
all here
word,
to learn, so it's fine.
please do have mercy. In the words of one of the favorite poems in my SHS, if you break us, do break us gently. Right.
All right.
Amazing.
We
So you
try.
mentioned some components of oral health, oral hygiene. You mentioned brushing, flossing, and dental visits. I'm very sure that my viewers would want to know a lot more about brushing. So let's talk about brushing. What really is brushing of the teeth? Are there really right techniques to go about it? You are the expert. Tell us about brushing of the teeth as hygiene.
Okay. So, as I mentioned earlier, toothbrushing is one of the commonest and most convenient method of cleaning the teeth and the tongue. And it's done with a toothbrush, yes, and we recommend using a medium or a soft bristled toothbrush. So the bristles are the parts that actually do the cleaning, the part that touches the teeth, the tiny projections. So those are the bristles. So some people think that using a hard brush actually does the work, but that's not so. So using a hard brush, first of all, damages the gums and then also the teeth, the enamel part as well. So we recommend using a medium or a soft bristled toothbrush. It's not about the force that you are using to clean. However, it's about the technique that you are using to clean. So the technique, the FDI recommends using the modified base technique. In simple terms, using a circular motion all around. We'll show a video to demonstrate it by using circular motions. Some of us, when we are brushing our teeth, hey, it's like you are scrubbing your bathhouse, chuku 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 chuku, back and forth. But that's not it. It's supposed to be round circular motions. So that's it about the bristle and then the technique. Then the frequency. So you're supposed to brush. Everyone is supposed to brush at least twice. We recommend twice a day, morning and evening. So in the evening, last thing before you sleep, after brushing, you don't eat again. So if you eat after, what you've done is cost 90, literally. So morning and evening last thing before bed. However, for people who are undergoing orthodontic treatment, like those in braces, in simple terms, they are supposed to be brushing more than twice, because after every meal the food gets stuck in between the brackets here and there. So for them, we advise that they brush after every meal if they can. But for everybody, on a large scale, morning and evening. And then one more thing I want to add about the toothbrushing. So you don't use one toothbrush the whole year, my brother. Every 3 months, replace your toothbrush, or even earlier, sooner than the 3 months. If you notice that the bristles are getting split, they are flaring up, or they are splayed, you have to change it. So you change your toothbrush or you replace it every 3 months or sooner if you notice that the bristles are getting flared up. Yeah, so that's about toothbrushing. We can share the video to demonstrate the technique.
All right. Thank you so much, Jokobad. You've really given some punchlines. I feel hurt already hearing you that we shouldn't brush our teeth like we are scrubbing our bathhouse. I
No.
actually have a funny story to that. I remember
Okay.
growing up when my mom would want to buy us brushes. I always want to buy the hard brush, because I feel like it's when you're brushing and you're bleeding. It means that's when like things are really coming out.
Hey.
But then I learned the hard way that no, it's not so, guys. Your teeth
Yes.
are not your bathhouse. Your teeth definitely do not need scrubbing with akesha like we've been doing at home, guys. So please,
Not at all.
let's brush them gently. I do love another thing that you said, that we should replace our toothbrush every 3 months.
Months, yeah.
I feel like
Three.
asking my audience and my viewers that, when was the last time you changed your toothbrush?
Hmm.
We're already in March, and maybe
Yes.
you can pardon people and say this is the third month. So, guys, from here, it means by the time this month ends, you should be on your way to the supermarket getting a
Yes.
new toothbrush. Today, we are saying bye bye to our old sins and we are repenting. Therefore, make it a point to add to your goals for the month that I am getting a new toothbrush. And if you would remember what she said, the toothbrush we are getting are the medium to the
Oh,
soft
so
bristled toothbrush. Please,
yes.
let's avoid the hard toothbrush that is coming. And my audience really are with me when they say that today Doc is coming for us. Doc is really coming for us.
Are coming
To
for everybody.
help us in demonstrating what exactly the technique she was talking about is, we have a video from the Global Ambassador of Oral Health, Dr. Dent Michael Ewa. He recently visited a school, Alpha Joy International, where he taught the kids how to brush their teeth. And so today I want to teach you. You learned it from here, Health Plug. Ask the expert how to brush your teeth and learn from the video. Let's take this video now.
When you are brushing your teeth, you do like this. Some of you don't you do this. Some of you too, you do side to side, like you're fighting with somebody. You brush it like this. If you do that, you damage your teeth. You're supposed to brush in circles. In what? Can you all see here? Sometimes some of you forget to clean that part. It's very important. You hold the brush like this, and you go behind the teeth like this, and you clean it like this. Can you see? Can you all see here? It's very important. You also need to clean that part. So that one, you hold the brush like this, and then you clean behind the lower front teeth, the chewing surfaces of the teeth, the one you use to chew your wele and your bone. You have to clean those areas. Don't leave those areas. That when you brush it normally like as you would. You see, you brush those areas normally like this. So whenever you are brushing your tongue, you don't do it like this. No. Some of you brush your tongue like this. No, you don't do that. So it's very important that you take the brush to the back and you rather do it back to front, back to front, back to front. Can you see? Back to front like this. So that you clean all the germs from your tongue. So ideally, we are supposed to brush our teeth at least twice a day. That's in the morning and morning and.
Ladies and gentlemen, that was Dr. Dent Michael Ewa with those amazing students teaching them how to brush their teeth. Guys, remember we brush our teeth
Evening.
morning and
Evening.
amazing. I can see that chat room is flooded with evening remarks. Just a recap
Yes.
of what you said. You brush in circular motion. Okay? Circular motion. That is the front part of your teeth that everybody sees. And then don't forget to brush the inner aspect of your teeth as well, which is also very, very important. Make sure that you brush your biting surfaces equally. And then, last but not the least, brush your tongue. And the brushing of the tongue is done from the back to the front, from the back to the front. Very, very important. You don't want to be talking to your partner and you open your mouth and then he goes like, today, dear, can I meet you later? So, guys, let's save ourselves and let's save our reputation by making sure that we stick to good oral hygiene. Thank you so much, Dr. Dent Jacobed. So we've learned about brushing. Let's talk about the second oral hygiene technique or step that you mentioned? I believe that was flossing, right? Tell us more,
Yes,
Doc.
plus
What is flossing?
yes. Okay. So remember the last time you were chewing your kebab or some very nice meat or kotoje, and you got some parts, some pieces of meat stuck in between your teeth. So for the average Ghanaian, the first instinct is to grab a toothpick, but that is not right. Using a toothpick damages your teeth and then also your gums. And if you are someone who has an appliance in your mouth, a filling, or you're undergoing orthodontic treatment, this toothpick can actually damage the prosthesis in your mouth. So we recommend using a floss. Now, what is a floss? What is a floss? So I have one here. So a floss is basically a thin thread that may be waxed or unwaxed, and is recommended, or is the approved method of getting rid of food that gets stuck in between your teeth. So if you are someone who has very tight contacts like myself, you don't have so much spaces in between your teeth, using a floss is actually the best way to get rid of that meat or pieces of food that get stuck in between your teeth. So we recommend using a floss, and the floss comes in, let me say, three forms. So we have the traditional thread-like type. I have one here. I don't know if you can see my screen. So the traditional thread-like type. So there's the floss that you can use. And then there's another one that comes in a more easier to handle manner, which is like a toothpick. So the one like the fork. Okay, I don't know if you can see, you can appreciate it. Yes. So there's this type as well. That's like a fork. So you use the thread parts to get rid of the food particles. Then, thanks to technology, there's also a third type. That's the water flosser. I don't have one here, but I made a video on it, a post on it on LinkedIn, so you can check that out. So the water flosser, that one comes like a tube with a stream of water at a high speed or high pressure that can help to dislodge the food particles stuck in between your teeth. And that is much helpful for people undergoing, those who are in braces. It's much more easier and simpler for them compared to the traditional floss or the fork-like type. So that's it about a floss. Yes.
Okay. So the flossing is to get food particles that are stuck in between our teeth out. Is that what you are saying? Like a summary of what you're sharing with us today?
Yes, not just food particles, but plaque in between, the parts that are very close, that the bristles of the brush cannot get rid of it. So the floss can go in between and then get rid of the plaque, food particles, whatever is stuck in between your teeth, because those areas also have to be cleaned as well.
Okay. Okay. And how often should we floss? How often should the
Okay.
flossing be done?
So I recommend flossing once daily, at least once daily. So you can add it to your evening routine. So you floss to get rid of the particles, then you brush. So you floss, then you brush. Flossing before brushing. Okay. But if you are someone in braces, it's much easier for food to get stuck in between. So after rinsing your mouth or brushing, if you don't have access to your toothbrush after rinsing, you can get a washroom somewhere. The floss is very portable and you can floss at your convenience. So yes, once a day. You can do it in the evening, most preferably.
Is there a technique of flossing? Maybe horizontal, vertical, or any way it goes up, down?
Okay. So the you see is a thread and it's very thin. So let me just put it in simple terms. So you slide it in between your teeth, as you can see in the picture, in between your teeth up to the gum level. Then you curve it around one teeth, then you bring it down, slide it again in the same spot, then curve it against the adjacent teeth. So you go all around to your teeth very gently in a rocking motion so that you don't hurt your gums. Okay, so very gently slide it around up down to the gum line, then around the one surface of the teeth, bring it down, same spot again, but this time against the adjacent teeth. Yes.
Thank you very much. What's the price of this flossing that we are talking about when we get to the market we want to buy, because now we are learning to do very good oral health activities or goals. So how much can I get some to buy?
Okay. So for the these ones, I think I got them latter part of last year. I think it's not expensive. I think this one, the third one, was around 20 something CDs. And then for the fork like types, there are different brands on the market. So it's even ranges from as low as 10 CDs to 30 CDs. You can easily get some from pharmacy, supermarkets, China Mall, any some dental clinics also sell it as well. So it's very easy to come by. It's very easy to come by. They are not hard at all.
Oh, that's lovely. And are there
Yes.
any particular techniques of taking care of them or maintaining them? Do we wash it in salt? How do we go about keeping or
Thank,
maintaining
thank,
the floss?
thank you so much for this question. So the flosses are single use. Please don't keep it after using it. After using it, dispose it. Whether the thread or the fork like type. After using it, please dispose it. Don't wash it and keep it. No, 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 no. It's single use, please.
Oh my god, please, we better go
Yes.
in economy single use. Oh,
Oh, please. This it's not expensive at all. It's not expensive, and there's a lot in it. Some of them come like 50 in a pack, 30 in a pack. So yes, and if you are doing it every day, I don't think it's something that should cost you so much. How much data do you buy? My brother and my sister. Oh, please don't do that.
ladies and gentlemen, amazing, beautiful viewers across the globe, you heard it from our expert. She says, and I quote again, the floss is single use. Use it once and throw it away. Guys, throwing it away means throwing it away. Don't reuse your floss. After all, how much is data? Yet we buy it. You heard it right here. You heard it at Health Plug Conversations. If you are joining us, we are still talking oral health with Dr. Jacob Bed Ama Edwache. We are learning about how to keep our health in check when it comes to our oral hygiene. We just went through learning about brushing, and currently we finished talking about flossing, which is something new, I believe, to quite a number of us. Now we move to the third aspect of oral hygiene, which I believe she mentioned, dental checkups. Dental checkups. You know, there's this misconception that dental checkups is a luxury, it's for the rich, and we can do away with it. Is it true? Why do we really need to come and see the dentist?
Okay, so dental. Well, I've also heard that a couple of times. Dental treatments and that are not entirely expensive. Let me see. What makes it look like it's expensive is, you see, when most oral conditions, when they start like in a very small way and progress. So let's take caries or cavity or caca, like most Ghanaians know. So before you have a full blown cavity, it starts as a spot discoloration. You notice maybe your some off white or brownish small spots. Then with time you get, if you don't do anything about it, you get sensitivity to maybe your sweet food, your cold drinks, before the actual cavity or hole begins. Then when this hole also begins, it goes through the different layers of the tooth. So the further down it progresses, the worse your symptoms become. If after all this you still don't do anything about it, now the tooth becomes so bad that you can't do anything about it and you have to take it out. And taking it out, so now you have to replace it. So imagine losing your front teeth. You can't be walking around fine girl with a very large diastema. You have to replace it, right? So let me take it back from the initial stages. So if you had come for your checkup and we noticed the discoloration, we could have done something there, a simple filling to get rid of it, or at the initial cavity stages you could have done a simple filling to solve the issue, but you don't do it and you get to the deeper layers. That one's when you come, we can do something called a root canal treatment to solve the issue. But if that one you don't come and you wait and the tooth deteriorates, like it gets so bad that you can't do anything about it, then now you have to extract it. And extracting it and you can't leave it like that. Say it's an anterior to the front tooth, you have to replace it. So right now the cost is becoming more. So that is what makes most people think that dental procedures are expensive, but it's not really the case. When you come earlier, you can put in interventions early to solve the issue. So dental treatments are not expensive. Please debunk that myth in your head. Okay, so now let's come to the reason why you have to see your dentist or you need a regular checkup every 6 months. So I'm sure my first point has convinced you about coming early for your routine checkup, so that if there's any problem, we can detect it at the early stage and put in an intervention. Then the next issue is that ideally you're supposed to see your dentist every 6 months for your regular cleaning or scaling and polishing. That's your professional cleaning. Because I don't know if you've noticed, the sometimes some people have this yellowish deposits around the teeth, what's the layman will call tartar or calculus. Yes, so as your regular dental visits, which is every 6 months, we do professional cleaning to get rid of that, because when those plaque are not removed and they are around it, that's what sometimes causes the bleeding gums that some people see when they brush. So your regular dental visit is very important every 6 months. So the whole year, just 2 times. Okay, so every 6 months, whether you have pain, whether you have an issue or not, please do well to visit your dentist.
You heard it here. Our expert says that do well to visit your dentist at least twice in a year, every 6 months. Today, we are really learning a lot, especially when it comes to timelines. We've learned that we brush our teeth at least twice a day if you don't have a prosthesis like a braces. We've also learned that we floss at least once a day, usually in the evening. And we are learning that we have to see the dentist at least every 6 months. Don't forget this frequency: twice a day, once a day, every 6 months. I repeat, twice a day, once a day, every 6 months. Thank you so much, Dr. Dent Jokobed. I see you in your dental clinic with your setup, beautifully seeing your patient, and I see the satisfaction on the patient's face.
Yes, very happy
Definitely
patients.
very, very happy patients, guys. Maybe the reason why I'm not happy is that you've not seen your dentist. So maybe it's time to go see your dentist. Before we continue, I just want to take a couple of questions from the comment section. I see that we have some so far based on what we have shared. And my very first question is from Metho Hymns Officials. Oh, that's so lovely. We get to have you with us today. They are asking that how do we floss the molars and the premolars? I believe you mentioned that with a thread, when it comes to our incisors, it's just in and out, in and out. So how do we floss our molars and our premolars?
Okay. So it's basically the same procedure. It's not so different. So if you are using the thread one, you wind it around 2 fingers. So one on the left, one on the right, and your thumb as support. So you just slide it at the posterior regions. That's where the molars and the premolars are. It's also basically the same procedure. So around your 2 fingers with your thumb, you slide it around. If you are using the one that comes in the form of the fork, that's even much easier. You just put it there and slide it up and down, up and down. It's basically the same thing, not so difficult.
All right, thank you so much. I see amazing comments also from our viewers. We have someone saying that they are impressed that we get to show the video. I'm glad that you are learning a lot. Grateful to have you join us. And as usual, Dr. Med Belinda Joe is really on with our recaps, helping us remember that we brush in circles and we definitely have to brush our tongue. We have a huge shout out from Deborah Doku saying that Dr. Jokobert is her personal dentist. Okay, go Dr. Jokobert. I see you with a lot of fans out here in the viewer section. Right, there's another question again. The question is, What causes halitosis? That's quite a huge term. I believe this person is a medical professional. What causes halitosis? And he's saying that someone may have very white teeth and does take care of their oral hygiene very well, but yet they have bad breath. What's really wrong? I expect
Okay.
over to you.
All right. So halitosis, in simple terms, for those of us who may not know, is bad breath or malodor. Okay, that's halitosis. And yes, true. Someone may have white teeth, good oral hygiene, and may have a bad breath. So the causes of halitosis are grouped mainly into two groups. So we have dental factors and non-dental factors. So dental factors are factors related to the teeth or the oral cavity. So those are the dental causes of halitosis. And we also have non-dental causes of halitosis. So let's start from the dental causes. So if someone has a lot of calculus or plaque around their teeth, very poor oral hygiene is one of the causes of halitosis, because this plaque or calculus is caused by bacteria acting on the food that we eat and producing these deposits around the teeth. So if they are there, they produce a bad breath. And then if you have cavities, caca, it can also cause bad breath. Not cleaning your tongue, that can also be a factor for halitosis. And let's come to some other causes that may not really be dental but are also in the oral cavity. If someone has tonsillitis or tonsil stones, that can also cause very bad breath. So that's another cause of halitosis. And some respiratory conditions as well can cause bad breath. Then uncontrolled. So right now I'm moving towards the non-dental factors. So uncontrolled diabetes can cause this breath. We call it ketones breath, can cause that as well. Then end stage renal conditions can also result in halitosis. Then you also have sinusitis. So talking about all this, you can tell that it's not just dental factors that can result in halitosis. So when a patient presents, we look at all these factors. So if it is dental, we tackle the dental factors to ensure that the patient is okay. But if it's non-dental, then we refer to the appropriate specialty for further management. So yes, you can have someone with very white teeth and good oral hygiene, yet have a bad breath. So in that case, it's most likely a non-dental factor. I also want us to understand that there are sometimes temporal halitosis. Let's say somebody has eaten garlic, onions, these very strong foods that contain sulfur compounds, that can also result in temporal halitosis, because when the person brushes or takes a mint gum, it will be away with. And also sometimes it's pseudo halitosis. So let's say somebody has um you know the more you talk or the more you drink water, it sort of aids in keeping your breath fresh. That's why when everybody wakes up, we all have a bad breath, because your mouth has been closed for a very long time. It's been dry, no water, no saliva. So the bacteria have had enough time to, at the normal oral flora. So that can also result in a form of halitosis. But that is also, temporary. After brushing, it should be fine. So all these are things that can result in halitosis.
I'm really learning a lot today. Wow, thank you so much, Dr. Jokobat. So, just a recap, she mentioned that halitosis can be dental, the causes may be dental or non dental. It could be temporary or it could be pseudo. And your pseudo just brings me to a time in JHS. I was once a class rep. Hey, go me, I've lived life before. And
They're
you know,
not
as a
easy.
we used to write names of talkatives for our teachers. And when you meet someone you don't like and the person is talking, you have the opportunity of doing DP or TP or QP. You know? So there was this boy at the back who really used to talk a lot. I can write DP for God knows how long he'll still be talking. So one time when the teacher came in to really lash the students, he kept asking him that, why are you always on the talkative list? And he goes like, say if I don't talk, my mouth will smell. Literally stated that Semankasa menum bebo,
And no,
and
I
we're
don't know.
all saying as a class. So yes, if your mouth is really shut for quite a while, definitely there would be some foul smell or malodor. And she mentioned some techniques to help. That was my next question. She said that we can take some mint, and some people also gargle, I think, some mouthwash to help with their mouth. That means that if you're going on a long distance journey, it'll be very good to keep these minty stuff around just in case. You never know who you meet. You don't want your mouth to be smelling like the garbage behind some houses. Yeah. We have
Yeah.
another question. How do we deal with the tonsil thing? I think you mentioned that tonsillitis is also a common cause of halitosis. So, how do we deal with the tonsil condition?
Yes. So for the tonsils, so it's in the region of, let me say, the throat or the back parts, the most back parts of the mouth. So for that place, it's not usually, it is in the domain of the otolaryngologist. In simple terms, the ENT specialist. So we refer those cases to them, and sometimes they take out the stones, sometimes too they take out the tonsils. And I saw one when I was in 37. It doesn't look like it was a very simple procedure. So for tonsils, the sinuses, we refer to the ENT department for further management.
Right. How will I know that I have a tonsil issue? What would really let me know that I probably have a tonsil issue that I'm dealing with?
Okay. So for most patients with tonsillitis, some way, somehow, they are able to detect, especially mothers. There's a saying that mothers are everything. They are doctors, they are teachers, they are lawyers, they are everything. And there's a form of truth in that. So they are able to detect because sometimes, not sometimes, most times, they have this swelling at the posterior parts of the mouth. Yes, thank you. So at the posterior part of the mouth, they feel like there's this large swelling there. For some people, it becomes so huge that breathing becomes, a bit of a difficulty, like they have a cold or a respiratory condition. So they are most likely always able to tell that they feel something in their throats or at the back of their mouth. And lo and behold, when you use your tongue depressor and they open, you're able to detect. So they're almost always able to detect it themselves.
Right. Thank you so much for shedding light on the tonsils. We really appreciate you for that. But I also have a question. Before coming, one of my members from the Health Plug Network. For those of you who don't know, Health Plug Conversation is a subsidiary of Health Plug Network, which is a network of people who are gathered together in a community to strive to be better with their health by providing health knowledge, by providing health resources and access to healthcare experts like Dr. Dent Jokobet herself to be able to stay on top of our health. So we have a group where we meet and we get better helping one another in the community. Now, one person from the group asked me that they've heard we should be using fluoride toothpaste. We should be using fluoride toothpaste. But in the days of old, I remember my mommy telling me when you're young and you were a child, they used to use charcoal and plantain to brush your teeth to give you white teeth. So where from this fluoride toothpaste that we are all saying. And nowadays too, we have a lot of formulations of toothpaste with charcoal combination. Right. So can I decide to go the olden way after I work for them and let go of maybe my floral toothpaste sometimes and also go by the charcoal and plantain method? Will that help me? Are there really benefits to this floral toothpaste?
Okay. So what fluoride does is it forms a complex around the teeth to strengthen it. Okay, so fluoride is to strengthen your teeth by forming a complex around it. And it doesn't whiten. The essence of fluoride is to strengthen the teeth, not whiten. Okay, so the charcoal toothpaste or the plantain leaves and then the charcoal. So charcoal has abrasive materials which help with the whitening aspects. Okay, so fluoride and then the charcoal, like, is totally different. So what I want you to understand is that the fluoride is to make your teeth stronger, to be able to resist the cavities and other wear from what we eat and what we chew and all that. But the charcoal is, it has an abrasive effect, okay, which helps in the whitening aspect. Now think about this. In this day and age, like myself or yourself or many of us who are almost always on the go, how, what time will you get in the morning to come? And that thing, my mother has done it to show us before. Like the plantain, is the head, then they squash it with stone, okay, and then they grind the charcoal. So like now your plantain becomes sort of like spongy sort of, and then they use they boil the charcoal, like they use it in the charcoal and then rub it around. Like it's so time consuming, very inconvenient. How many of us will be able to do this and do it effectively? Do you get it? So the toothbrush, using the toothbrush with your toothpaste is much more convenient and even easier. You can teach a little child to do it whether you're around or not. So what you should look out for in toothpaste when you're getting them is mainly the fluoride. Okay, the charcoal is just like an additive. The charcoal, the other flavors I may come with, is just additives for different effects. So the charcoal, like I mentioned earlier on, is for the whitening effect. But what we mainly recommend is the fluoride. The fluoride is what makes the tooth strong and resistant against the caries attack. So what you should look out for is the fluoride in the toothpaste.
Paste. You had it here. The fluoride is not for whitening, but it is for strengthening. And you definitely need strong teeth to be able to eat all those great meals that you want. I can't imagine you not having teeth and seeing chicken and seeing all these amazing foods in front of you, and go like, I wish I knew minimark. So guys, let's protect our teeth and let's buy fluoride based toothpaste. Right, there's still some questions in the comment section. The question is, do we need to brush the roof of the mouth? Do we need to brush the roof of the mouth? And then the second one, which is almost like this, is, are our tonsils brushable? Are our tonsils
Okay.
brushable?
Okay. So I'll take the first one. So the roof of the mouth, that's the palate. So we have the hard palate and then the soft palate. So if you notice, it's synonymous to your gum, the roof and then the gum. So they are soft tissues. They are not like your teeth, which is like mineralized and hard. So we don't brush the roof of the mouth, okay? The roof of the mouth or the gums is like brushing your gums. You are going to cause damage to it. So you don't brush the roof of your mouth. You imagine when you are eating and you take something very hot, see how it bends you. Then now imagine actually scraping that part with the bristles of your brush. You are going to cause damage. So we don't brush the roof of the mouth. That's the first part. And then the tonsils, that one as well. We don't clean or brush the tonsils. No. I don't know if maybe you notice, try this experiment in your house. Try taking your finger to the back parts of the roof of your mouth. You have this reflex of, about the gag reflex, like you would want to throw up. So taking your brush, and that's the region where the tonsils are found. So taking your brush there is going to stimulate the vomiting, the gag reflex for you to throw up. So you don't clean the tonsils. There's nothing you can really do about it. It's just like the ear and other parts of the body, which you say they are self-cleansing. You don't really do much about it. So no, we don't clean the roof of the mouth.
Right, so you had it from here. We do not clean the roof of the mouth nor our tonsils. Those are very soft parts of our teeth or our oral cavity. They are very soft parts of it. If you do that, you are definitely going to bleed. Okay, so please don't attempt to brush it. It's not for sure. I know you want white teeth to look all great and everything, but let's be mindful, okay, of how we brush, and that definitely means that we shouldn't brush the roof of our tongue. Now, talking about white teeth, let me just box a bubble, guys. Talking about white teeth, Teeth whitening. Teeth whitening. People say it's a luxury, but are our teeth really white? Is the color of our teeth white? Is if my teeth is not white, am I normal? What if my teeth is creamish? Is it okay for me to whiten my teeth? And is it dangerous? I feel like sometimes maybe it's dangerous. Yeah, weakening your teeth. Can you tell us a bit about teeth whitening for those who want to have perfect sets of white teeth amongst my viewers?
The Hollywood smile. Okay, so the teeth are the color of the teeth. It ranges from an off-white to a creamish, darkish brown color. So for
Wow.
children's, yes, that's the color, or those are the shades of healthy teeth. Having white
Wow.
teeth doesn't necessarily mean you have healthy teeth. So for
Wow.
children, their teeth are not as mineralized. When I say mineralized, they don't have all the ions that you need in a healthy teeth because they are still growing. The iron content in their teeth are more. So they have more white teeth. That's the milk teeth or the baby teeth. So those are white. But the adult or permanent teeth, those are not so white. The shade varies from each individual. Okay, so they are all different kinds of healthy, but they are all healthy. So for adults, your teeth may not be as white as that of a child because your teeth are more mineralized. They have more of the ions, the calcium, the fluoride, and all the other ions. So your teeth has less water content and more minerals. So that is what is not making it so white. Okay. And so like I mentioned earlier on, so this it's about having healthy teeth and not really white teeth. The fact that you have white teeth doesn't necessarily mean your teeth are healthy. Okay. And what teeth whitening does is, or the intention of teeth whitening was to get rid of stains that are present in some people's teeth. Stains that may be congenital, those who may have tetracycline staining. Maybe during the pregnancy, their mom took tetracycline. So such people, when they are born, they have a discoloration on their teeth, or maybe you have some form of hypoplasia, meaning your teeth didn't form well. So such people may resort to even that one, not staining, not whitening, but using other procedures like veneers. So the main aim of whitening was to get rid of stains. But in our day, it's because of the influence of the celebrities and all, everybody wants to have white teeth. Well, it's not bad, to be honest, but the side effect comes when you do it continuously, because what you are doing is you are removing stains. Okay, but now after removing the stain, you are now on the tooth structure itself. So it's like you are wearing up the teeth structure, and as you go in the deeper layers of the tooth beyond the enamel, you begin to have sensitivity with time. Okay, so the more sessions you have, the more prone you are to getting more sensitive teeth. So it's like maybe let's take skin bleaching. It's not maybe not a very right example to use, but maybe you use some creams or something. Maybe first time it's not really doing much. Second time, not doing much. But maybe after your third, fourth time, now you see that your skin is very with the slightest cuts. It takes so long to heal and all that. So just like that teeth whitening, it's okay if you are doing it for the stains, but then if you continue to do it subsequently and you expose the deeper layers of the teeth, then now you have other problems like sensitivity. And even when you do that, your teeth now becomes less resistant to the stain. So maybe I, who hasn't done tooth whitening before, I can eat my abenkwai, my sobolo, it will be fine. I can rinse my mouth and I'm good. But either you have done whitening like 4 or 5 sessions, now your teeth are easy, like the stains get stuck on the teeth much more easier. And now you want to go again for another session to whiten it. So you have to weigh the pros and the cons. Yes. So I want you to understand that healthy teeth are not the same as white teeth.
Healthy teeth are not the same as white teeth. Guys, healthy teeth are not the same as white teeth. So when your folks are comparing your white teeth as a baby, tell them that you learned from health blog conversation expects that those are baby teeth. It's different. It doesn't have calcium, it doesn't have iron. I have iron, I have calcium, and healthy teeth can be off white. That doesn't mean that you shouldn't brush your teeth and say that off white is still healthy, guys. Make sure to brush your teeth at least twice a day. Thank you so much, Dr. Dent Jokobert, for this insightful session that we've had. I've really enjoyed a lot. I've learned a lot, even as a healthcare professional. I'm definitely sure my viewers also have done the same. Before we take our very last question, I just want us to talk about sensitive teeth. Sensitive teeth. You mentioned that one of the side effects of healthy teeth, of teeth whitening, is making you more susceptible to food stuff. So what how can I, as a person who is known to have sensitive teeth, manage my oral health? What are the do's and don'ts for me in ensuring that I'm taking care of my sensitive teeth?
Okay, so if you have sensitive teeth, something can be done about it. So we have fluoride toothpaste on the market. Sorry, we have desensitizing toothpaste on the market, like Sensodyne and Pepsodent Sensitive Experts. A lot of them, Kojak P, which help to seal the tubules. That's what is making your teeth, let me say, sensitive, because they are more porous. So the nerves, no, now I'll go too technical. So that's what's making it more sensitive, or having that cold electric like feeling. So if you have sensitive teeth, something can be done about it. And one thing that can also result in having sensitive teeth is the diets we take. Okay, so if you're someone who takes a lot of acidic foods that have so citrus fruits, maybe these sodas, the fizzy drinks, they have an acidic effect on the teeth, which sort of wear it out gradually. So that can also result in sensitivity. So in taking care of your teeth, as someone with sensitive teeth, you have to watch your diet, what you are taking, and then also using these desensitizing toothpaste can also help. And also see your dentist as well. There might be more than that. I had one patient one time who came here, she was saying she has tooth sensitivity in one particular tooth, but examining the tooth clinically, it was fine. It wasn't tender or anything. But when I blow air on it using my instrument, she jerks like off the chair. So taking an X-ray, we noticed that there was caries under the tooth which looked perfectly fine. So if you're having sensitive teeth, you should also do well to visit your dentist to be further examined clinically to find the source, and then also a treatment.
Thank you so much, Dr. Jokobet. And my last question comes, I'm sure a lot of people are itching to hear. Is coming to see a dentist covered by the National Health Insurance? Because you are saying that I should come for dental checkups. I should come for dental checkups. And we've also heard that dental visits may now be debunked it, that is for the luxurious. So we want to be more preventive. We want to be proactive. Is the dental visits covered by the National Health Insurance for those of us in Ghana?
Okay. Yes, it is, but not fully. So in the government hospitals, some of them even accept the private insurance. So it's the NHIS covers a large amount of, well, not a large amount, but a certain percentage of dental procedures. So like your consultation, and if you do some procedures like the fillings, working in the government sector, I know it does cover to some extent. So you might have to top up a few CDs, but it's not so much. And there are some private insurance companies that also cover dental procedures. So you want to verify with your, maybe there are some companies that have insurance for their staff. So you want to verify with your HR to find out if it covers. And then yeah, so most insurance companies do cover, but not all of them. So for some prosthesis and dental treatments like the braces, as for that one, most of them, in fact, I don't know of anyone who covers those. And so those ones, you have to do so towards it. Yes, unfortunately.
But why do people
Consultation.
sorry?
Uh-huh.
Why do people like braces? Is it just for fun? As I was told when I was growing up that braces are for the rich.
No, it's not. It's not for fun. It's not for fun. So braces is to correct malocclusion. In simple terms, your teeth are not well arranged. So that is the importance of braces. It's not for fashion. anybody you see in correct braces, now there are fashion braces that people can order from Alibaba and online. So the correct braces is always to correct a problem, a malocclusion, whether you have your teeth being projected too forward, or you have some crossbite somewhere, or one is looking crooked, you have some crowding somewhere. That is the essence of braces. It's not for fashion. Yes, there's actually a very important use for it. It's not for fashion. And it's not just like, if you ask anybody who has undergone orthodontic treatment, the teeth are moving like you are arranging it, so there's some form of discomfort. So it's not for life at all. If they had their way, they wouldn't be in it. But beauty is expensive, like my roommates will say. So it's not for life.
Thank you so much for answering. So sorry for interjecting you. You also mentioning some of the procedures that are not covered by the NHIS, so that people would know. You said braces are not covered. Any other thing that is not covered, so that we will be mindful when we are visiting you. Are extractions covered?
Hello, Dr. Nessa, please can you come again? You were breaking.
Right. I said thank you very much for that important information that beauty is expensive. Very, very expensive, especially in this time of the world. I was saying that you mentioned that braces are not covered by any tires. Any other thing,
No.
another orthodontic issues. Are extractions covered? Maybe I have a toothache, I want to extract it. Would that also be covered by any tires?
Yes. So it does. When I was in CCTH, it does cover for extractions, depending on the facility. For some places, well, like when I was in 37 like this, they top up a few cities, but for CCTH it was free. They don't pay for extractions. And then for fillings too, they do a little top up. And sometimes, so you see, the NHIS covers one procedure per week, or I think per day, or something like that. So if, let's say, you have maybe three fillings to do, the NHS will cover one, and you have to pay for two, the remaining two. Or what some people do is they'll do one this week, next week they'll come and do the other one, then the following they'll do the other one. So it's up to you if you have the
That's
time.
well, thank you so much. It's been such an insightful conversation. Don't you believe so, my viewers? Let me know your thoughts. How has the session been for you? What did you learn? Kindly share in the comments so that we know that we really have impacted you today. Thank you so much, Dr. Dens Jokobert Ama Eduache. Can we have some of your key takeaways? It's really been insightful. What are your key takeaways for anyone listening to us today, especially when it comes to oral health?
Okay. So in summary, I'd say everybody should make oral health a priority. It's not a luxury. It's not a luxury at all. It's actually very important. So make sure to make oral health a priority. Brush twice daily, morning and evening. Evening, last thing before you sleep. Don't eat again after brushing. Make sure to floss as well daily. Get a floss and floss as well. And then do all to visit your dentist every 6 months. So twice, only 2 times in a year. Let us see your face and make your smiles more beautiful. Yes, so that would be my key takeaways.
Thank you so much. So from the comment section, Mr. Odo Anoche Samuel says that the session has been very enlightening. We also have Dr. Belinda saying that, okay, wow, we learned something new that the fashion bracelets are called grails. Okay, interesting. We also have Holistic Medic Network highlighting the fact that beauty is very, very expensive. And we have people actually making resolutions that they will start making regular dental checkups moving forward and also flossing moving forward. Thank you so much, Dr. Jokobert, for today. To our
Thank you
viewers
for having me.
and to our listeners, thank you so much for joining me and my amazing guest. Unfortunately, this is where the curtains will be drawn, and this is where time will have for the two of us. It's been amazing having you. It's been amazing having your questions and your contributions. This is the Health Plug Conversation Ask the Expect, and definitely expect us, God willing, next month with another Expect at your own convenience. toodles, and have the rest of your evening lovely. My name is Dr. Vanessa Abakumakwe, your ever affable, ever lovely host of the session. Have a good evening, everybody. Bye bye.